Hi, my name is Lucas Ferreira, and I want to explore on whether hospitals and doctors should offer palliative care to patients with severe mental health issues in dying. I understand that this is a very deeply emotional topic on on what should we do when a patient's treatment fails them. Specifically, should we allow this patient with a severe mental illness to die if their suffering becomes too unbearable? We're going to delve deep into this complex and sensitive issue and explain the ethical considerations surrounding autonomy, Kantian, and utilitarianism. Severe mental health illnesses like anorexia nervosa, treatment-resistant depression, and schizophrenia deeply affect individuals physically, emotionally, and socially. These conditions can lead to profound suffering, social isolation, and even death. For example, anorexia nervosa has one of the highest mortality rates of any mental illness. Up to 30% of patients remain unresponsive to treatment, leaving them and their families in despair. This raises an ethical question. When treatment fails and suffering persists, should we allow these patients to choose death through options like assisted suicide, or medical aid in dying? Imagine your loved one enduring persistent mental distress, unable to experience anything that life has to offer, with treatment failing to provide any relief. Should we allow them to die if their suffering is too unbearable? This raises ethical questions about the value of life, the limits to medical intervention, and the rights to individuals to choose their own path. The principle of autonomy is to prioritize an individual's right to self-determination. Including end-of-life care. Patients with the capacity to make informed decisions should have the right to choose their own paths, even if that path includes the decision to end their suffering through assisted suicide. In cases of severe mental illness, the ability to consent may be compromised, and it raises the question of whether a patient's autonomy should be upheld even when their judgment is impaired. But autonomy respects the lived experiences of the patient, recognizing their unique insight into their pain and quality of life. It's definitely impaired, though, whether a patient's choices is autonomous or driven by distorted thinking in these scenarios. From a Kantian ethics perspective, moral actions are guided by universal principles and the inherent dignity of individuals. Kantians emphasize the categorical imperative to treat humanity in oneself and in others always as an end and never as a means only. Respecting the intrinsic value of human life, suggesting that allowing somebody to die might violate the moral duty to preserve it. However, Kantians also respect autonomy, provided the individual's decision is rational. If the patient's choice reflects clear, rational thought, Kantian might consider it more morally permissible to end oneself. The categorical imperative, which requires us to act in ways that could be universally applied. For instance, normalizing assisted suicide for mental illness might not align with the universal duty to protect life. Utilitarianism focuses on maximizing overall happiness and minimizing suffering. In this context, it raises questions about the balance between individual autonomy and the overall well-being of society. Allowing patients to die through assisted suicide might reduce their suffering and provide relief to families and caregivers, aligning with the goal of minimizing pain, but it would raise societal concerns whether or not normalizing suicide for mentally ill patients is a good thing or not, but it would also get rid of the value of life as itself. A utilitarian approach would weigh the patient's suffering against the potential consequences for society, seeking a balance that maximizes overall well-being as a whole compared to just one person suffering. Assisted suicide or medical aid is dying is already practiced in some countries and states for terminal physical illness. Advocates suggest expanding these laws to include patients with severe mental illnesses who meet strict criteria of demonstrated treatment resistance and enduring suffering. Comprehensive assessments by mental health professionals to ensure decision-making capacity, and safeguards to prevent misuse. Case studies from countries like Belgium and Netherlands highlight both potential benefits and risks to such practices. But this doesn't only affect the patient in question, this also affects their loved ones and the people around them, because although one person may be mentally ill, they still had a life before that, and just committing suicide, it's also going to hurt the loved ones. And that's how they face emotional challenges, grappling with stuff like suffering the loss of their loved ones, or the fact that their loved one is going through such painful things that you can't imagine. One potential solution lies in palliative care. This approach focuses on alleviating suffering and improving quality of life rather than pursuing a cure. For mental illness, palliative care could mean tailored support that prioritizes comfort and dignity. For example, in anorexia nervosa, this might involve care plans that reduce distress rather than forced curative treatments that they have to follow on a strict regimen. Palliative care provides an ethical middle ground. It neither forces patients to endure unrelenting pain nor prematurely end their lives. Instead, it seeks to meet them where they are, offering relief and support. In some jurisdictions, though, end-of-life options such as medical aid and dying are available, which allow individuals to make choices about the end of their lives while respecting their autonomy.